Hi everyone, welcome back to my channel, The Learning Anatomy by Dr. Venumadhav. As a part of this, today we will learn about a bone that is present in the neck, and that bone is the hyoid bone. Hyoid bone is a solitary U-shaped bone present in the neck, and it is suspended by means of the stylohyoid ligaments from the styloid process. It is present a little bit behind the mandible and behind the junction where the floor of the mouth meets the neck. If you see, this is the floor of the mouth and this is the neck, and this hyoid bone lies here. Hyoidis is the Latin word that means upsilon, that means it is U-shaped. So that's why this name is given as hyoid bone. And this hyoid bone is very important in the neck because it helps in respiration, phonation, deglutition, and it maintains the muscles in position. So if you see the hyoid bone, it usually presents a body. This is the body and two pairs of cornua. These long ones are the greater cornua, and here where the body meets the greater cornua, a small projection should be here, which usually is joined to this by means of fibrous joint, and that is the lesser cornua. So if this is the body and this is the greater cornua, so this at this junction there should be a small projection like this. Those are may be missing in this hyoid bone. So, but these are the places for the lesser cornua where the stylohyoid ligament is present holding this bone, because this bone is hanging here in the neck. So, if you see the body is almost quadrangular in shape, presenting an upper surface, an anterior surface, and a posterior surface. So if you see the upper surface is flat, and you can see on the upper surface in the center a small ridge is there, indicating that the two halves of the hyoid bone are separate during early life, and they are fused together to form the complete bone. And on either side of it there are two depressions. Here you can see one depression is here, one depression is here. So these depressions are for the attachment of the geniohyoid muscle, which runs between the genial tubercles of the mandible and onto the upper surface of the hyoid bone. So this is the geniohyoid, and a little bit medially towards the center we have the attachment for the posterior most fibers of genioglossus muscle. Genioglossus muscle is the muscle of the tongue, and that originates from the superior genial tubercles on the mandible, and it is inserted, the uppermost fibers are inserted into the tongue, and the middlemost fibers they run backwards, and the posteriormost fibers are attached here. So this is the genioglossus muscle. Genioglossus, and this is geniohyoid muscle. And a little bit laterally at the base of this lesser cornua we will see the attachment for the chondroglossus muscle. This is the lesser cornua, this is the greater cornua, and this is the lesser cornua. And at this base we will see the attachment of the chondroglossus muscle. Chondroglossus muscle. This muscle is actually a part of the detached part of the hyoglossus muscle, and this hyoglossus muscle is separated into a chondroglossus and the hyoglossus by means of fibers of this genioglossus muscle. So these are the attachments you will see on the upper surface. If you see now, if you see the upper border which is present here, this is the upper border, this is sharp, and if you see in a side angle, the body is somewhat like this, So immediately below this hyoid bone, you will see the thyroid cartilage like this. The upper surface or the upper border of this thyroid cartilage is attached to the hyoid bone and the greater cornua by means of a thyrohyoid membrane. This is the thyrohyoid membrane which runs behind this hyoid bone and joins the upper border of the hyoid bone. So this is the thyrohyoid membrane. And this thyroid membrane, if you see, there is a space between body of the hyoid bone and the thyroid membrane. This space is filled by means of a subhyoid bursa. This is the subhyoid bursa. Bursa is a mucus lined pouch having some synovial fluid, and it acts as a shock absorber here. So this is a subhyoid bursa. For the subhyoid bursa, there is a depression also present here. You can see on the back side, you will see a depression in the center. Here this is the depression and this is the upper border. So the thyroid membrane is attached to the entire upper border, and the subhyoid bursa is present behind the body of the hyoid bone. And in the center, in the most central part, in here we have the attachment of the, if you see in a lateral section, if this is the hyoid bone, and we have an epiglottis here inside. The epiglottis is here, and we have the thyroid cartilage is here, and this is attached to the thyroid cartilage, lamina of the thyroid cartilage inside. Then this is attached here with the thyrohyoid membrane, and this hyoid bone is attached to the middle of this epiglottis by the hyoepiglottic ligament. Hyoepiglottic ligament. So it holds the epiglottis, thus helping in respiration and deglutition and phonation also, because it is also, this is a laryngeal cartilage. And also this, if you see, this is the place for the attachment of the hyoepiglottic ligament. Now if you see the front portion of this body, on the body we will see, so this is the upper surface and this is the body, anterior surface of the body, where you will see attachments of mylohyoid muscle here. The mylohyoid muscle takes origin on the mylohyoid line of the mandible, then it converges, the most posterior fibers are inserted on the front of the body of the hyoid bone here in this part. So below that, on the most medial part, we will see the attachment of the sternohyoid muscle. So this is the mylohyoid muscle, this is the sternohyoid muscle. Sternohyoid muscle. And lateral to the sternohyoid, we will see the attachment of the superior belly of omohyoid muscle. Superior belly of omohyoid. So these are attached here on the body. On one side, above we have the attachment of the mylohyoid muscle, and below on the medial aspect sternohyoid muscle, and laterally we will see the attachment of the superior belly of omohyoid muscle. So these are attached like this on the both sides. And on the upper surface we have the geniohyoid, genioglossus and chondroglossus muscles. This is how they, this angle, the fibers are curved in this angle like this. And if you see the cornua, it is flat from above downwards. And if we see the lower border, this is the lower border of the body. This is the lower border of the body. We have few attachments to this. The deep cervical fascia has 3 layers: one investing layer around the neck, one pre-tracheal layer that runs in front of the trachea, and one pre-vertebral layer in front of the vertebra. So that pre-tracheal layer, if you see in a frontal position, that is from the front side, the hyoid bone is present like this, and we have the thyroid cartilage which is present like this. The thyroid cartilage has 2 oblique lines here, and the cricoid cartilage is present here. And the deep cervical fascia, the pretracheal layer comes and attaches to the oblique lines first. So from here, after attaching to the oblique lines, it converges and attaches to the lower border of the hyoid bone like this. So this is the deep cervical fascia which is attaching to the lower border here. And also sometimes what happens, thyroid gland, if we see the thyroid gland, that will have 2 lobes, one right lobe and one left lobe, and sometimes a pyramidal lobe may be present here in the usually to the left side. And this pyramidal lobe sometimes is connected to this hyoid bone by means of a fibromuscular band that is called levator glandulae thyroidae. This is the name given to this, and this is attached to the hyoid bone to the lower border of the body like this in the center, usually to a little bit to the left side here. So deep cervical fascia, and if at all present, this levator glandulae thyroidae also attaches to the lower border of this hyoid bone onto the body. Coming to the greater cornua, it is flat from above downwards. The flat upper surface and the upper border gives attachment to the fibers of the middle constrictor muscle. So this upper border on the cornua, greater cornua, gives attachment to the middle constrictor muscle, and those fibers almost reach the base of the lesser cornua, which should be present here. Then coming to the anterior surface, we have the origin for the hyoglossus muscle. From the hyoid bone to the glossus, that is the tongue. So this muscle goes to the side of the tongue by starting here. So hyoglossus muscle is attached here, and that almost encroaches onto the body junction of the cornua with the body. If you see the lower border, this on the lateral aspect gives attachment to the thyrohyoid muscle. So from this oblique line, we have the attachment for the from this oblique line should be like this. So this gives attachment to the thyrohyoid muscle. So this is the thyrohyoid muscle, which is the continuation of the sternothyroid muscle. The sternothyroid muscle from the sternum to the thyroid cartilage. So this is the sternothyroid, and this is the thyrohyoid muscles, and this is attached here. In front of this, we have the attachment of the stylohyoid muscle, which is coming from above and splits into two to attach with the upper surface and the front portion of the junction of the cornua and the body here. So what happens is, from the styloid process, if this is the styloid process, I will try to explain in a separate diagram. If this is the zygomatic bone, and we have the external acoustic meatus, mastoid process, and we have the mandible here, and the styloid process is somewhere here a little bit medially, and we have the hyoid bone here. And from here, what happens is, from the styloid process, we have one ligament, the stylohyoid ligament from the tip comes down and attaches to the lesser cornua here. And a muscle, the stylohyoid muscle, comes from the tip and it comes down, splits into two and attaches to the lesser at the base of the lesser cornua and to the greater cornua like this after splitting into two. So this will split like this. Like this. The digastric muscle has two bellies. One belly, the posterior belly is from the medial aspect of this mastoid process. So it comes down like this, and the intermediate tendon passes between these two. So if the anterior belly from the base of the mandible at the symphysis mentae, and that forms the intermediate tendon. So the digastric muscle goes through this like this. So this is the digastric anterior belly of digastric muscle. And this is the posterior belly of digastric muscle. Also, the deep cervical fascia gives a sling around this digastric muscle and attaches to the lesser cornua which is present here. So this is how the digastric muscle is present, and this is the stylohyoid muscle. This is the stylohyoid muscle that splits and encloses the intermediate tendon of the digastric belly and attaches to the cornua of the hyoid bone. And the lower border of this will give attachment to the fibers of this thyrohyoid muscle. So these are the attachments for this hyoid bone. If you see, few groups of muscles are arranged above this bone and few are below this bone. The muscles which are arranged above this bone are called suprahyoid group of muscles, and those are below this muscle are called infrahyoid group of muscles. If you see the suprahyoid group of muscles, you will see the digastric muscle, hyoglossus muscle, geniohyoid muscle, genioglossus muscle, chondroglossus muscle, and middle constrictor of pharynx. And also, if you see the ligaments, stylohyoid ligament, thyroepiglottic ligament, all are attached to the upper border. And also, the thyroid membrane is there. The thyroid membrane between the thyroid cartilage and the hyoid bone forms three ligaments. One in the middle, that is the median thyrohyoid ligament, and one on both corners of the cornua, forming the lateral thyrohyoid ligaments. In the lateral thyrohyoid ligaments, if you see, sometimes what happens is a small cartilage may be present in the middle, that is called tritigial cartilage, or the cartilage tritigia. This is the name given to that cartilage that is present in the if this is the greater cornua of the hyoid bone, and this is the upper border of the thyroid cartilage. So in this part, this is the lateral thyrohyoid ligament. Sometimes you may find a small cartilage here which is meant for support, probably because functions are not exactly known. So this is called tritigial cartilage. So these are the attachments of the hyoid bone. If you see the infrahyoid group of muscles, you will see the mylohyoid is also suprahyoid because it is going to the mandible, forming the floor of the diaphragm. So infrahyoid group of muscles, they are the sternohyoid, which is attaching near the middle, and the omohyoid is present here, and here the thyroid is present here. The thyroid is continuing down as sternohyoid, and these four muscles are called strap muscles or infrahyoid muscles. We have the attachment of the tracheal layer of the cervical deep cervical fascia attached in the middle, and also sometimes the levator thyroid glandulae, if at all it is present, it is attached to the lower border of the hyoid bone. This hyoid bone is helping in maintaining the stability of the neck, and it helps in phonation, respiration, deglutition, and everything. So, and it is very delicate bone, and this is the hyoid bone. So this completes today's class. Thank you very much. I would like everyone to please watch the video completely, and please like it, share it to your friends, and please subscribe to my channel if you are not subscribed yet. Thank you very much.